Malaria. Malaria is a disease caused by the invasion of the erythrocytes by any of the four species of the genus Plasmodium and characterized by high fever, often intermittent, anemia, and the splenic enlargement. The causative agents for malaria are Plasmodium falciparum causing malignant tertian malaria, Plasmodium vivax causing benign tertian malaria, Plasmodium malariae causing quartan malaria, and Plasmodium ovale causing ovale malaria. The modes of transmission of malaria is through the bite by the female Anopheles mosquito, also by the blood transfusion and transplacental. The people who are at risk of severe malaria are children in endemic areas aged 6 months to 6 years, travelers from the non-endemic areas, people returning to highly endemic areas after a few years of absence, indigenous pregnant women. Life cycle. The man is infected by these scyzones by the bite of the mosquito. The tissue phase or the pre-erythrocytic schizogony takes place in the liver for around 8 to 25 days. Then the merozoites which are formed gets released into the circulation. Now the erythrocytic phase forms with the formation of the tropozoites. Then the gametogony takes place where the formation of the macrogametocyte and the macrogametocyte. This is again taken up by the mosquito after biting the human. The zygote and the oocyte then forms in the mosquito. Then the sporozoites gets released into the salivary gland of the mosquito, and when it again bites the other humans, the sporozoites gets injected. Clinical features. The incubation period is from 9 to 30 days. There is sudden onset of fever, headache, loss of appetite, lassitude and pain in the limbs. On the cold stage, there is chills and rigors with headache, nausea, malaise as well as the anorexia. On the hot stage, there is dry, flushed skin, rapid respiration and marked thirst. On the sweating stage, the temperature falls after profuse sweating. There is also the pallor and hepatosplenomegaly. The severe malaria is defined as the malaria caused by the falciparum species that sufficiently is serious to be an immediate threat to the life and having one of the following changes, that is, the change of the behavior, confusion or drowsiness, altered consciousness or coma, convulsions and hypoglycemia. There is also the acidosis, difficulty in breathing or pulmonary edema, oliguria or acute severe anemia with hematocrit of less than 20 and hemoglobin of less than 6 gram per deciliter. Also, there is circulatory collapse or shock in algid malarial case and hemoglobinuria, also known as the black water fever. Few other manifestations like jaundice, bleeding tendencies, prostration, hyperpyrexia and hyperparasitemia can be present. The differential diagnosis of malaria could be septicemia, UTI, Kala-Azar, typhoid, miliary TB, encephalitis or meningitis. Thick and thin blood film for parasite can be done. On CBC, there is leukopenia with relative monocytosis, thrombocytopenia and decreased hemoglobin. Also blood glucose, urine for hemoglobinuria, bone marrow, ICT for malaria, liver function test, serum electrolyte and renal function tests could be done. Treatment. The treatment for uncomplicated malaria could be tablet chloroquinolone once daily for 3 days, total dose of 25 mg base per kg. Also, tablet primaquine 0.5 mg per kg single dose on the 4th day. The treatment for failure malaria could be tablet quinine 10 mg per kg TDS for 3 days. Also single dose of sulfadoxine plus pyrimethamine at the dose of sulfadoxine 25 mg per kg and pyrimethamine 1.25 mg per kg on the day 3. Additionally, tablet primaquine 0.5 mg per kg single dose on the 4th day. For severe malaria or chloroquine sensitive malaria, chloroquine 5 mg base per kg in DNS by constant IV infusion over 6 hours, continuous administration for a total of 5 doses could be given. Or chloroquine 3.5 mg base per kg 6 hourly intramuscularly as subcutaneous can be given. For severe malaria, which is chloroquine resistant or sensitivity of which is unknown, loading dose of quinine hydrochloride 20 mg salt per kg by infusion over 4 hours in the DNS could be given. The maintenance dose could be quinine 10 mg per kg by infusion over 4 hours in the DNS 12 hours after starting of the loading dose, which is repeated every 12 hours until the patient can take orally. Single dose of sulfadoxine and pyrimethamine on the day 3, as well as single dose of primaquine 1 day after sulfadoxine and pyrimethamine. The other drugs that could be used are amodiaquil, proguanil, chlorproguanil, mifloquine, and quinhausu. The complications of malaria could be cerebral malaria, black water fever, DIC, jaundice, hepatic encephalopathy, diarrhea, anemia, and renal failure. Thank you. Please do like, subscribe my channel and share this video.